I'm now at 7 months and the pictures speak for themselves.
Let's have a look.
Yeah, okay. Okay, so Halloween is just around the corner. And today at Terra Medical, we're going to serve some really good tea.
Okay.
Horror story. So Halloween is just around the corner. And at Terra Medical, we're here to serve some really good tea.
No cat.
It's a hair-related horror story that we found scrolling through Reddit. Hi, I'm Andrea, and today we have Dr. Chong to hear this horror story and add in a little bit of comment.
I'm scared. Wait, so let me just clarify. You're
Okay.
picking stuff up from Reddit that you found, and you're just gonna read it ad verbatim what the poster posted on Reddit.
Yes, exactly.
Okay.
So we get to hear this tea first.
Authentic reactions.
Yes.
Let's do it.
Okay, so 7 months ago, I had a transplant with Dr. at Refine Surgical in Nottinghamshire, UK. I decided that I wanted to fill in my hairline, so I Googled hair transplant near me.
Okay.
And this clinic popped up. They had a 5-star review on Google and Trustpilot.
Sounds good.
They had a good CQC rating, which is Care Quality Commission. It's similar to Case Trust in Singapore.
Yeah, I've heard that being floated around the UK circles, yes.
Okay. They had photos on their Facebook page of Dr. standing next to Dr. and Dr.
And those are big names in hair transplant circle.
So this was at the 2023 BAHRS conference. I paid for a consultation with the doctor, and he said all the right things about how we would avoid the pluggy look, place singles in the hairline, angle the hairs to create a natural look, manage the donor area for future requirements, etc. All the things I expected to hear. He even showed me some poor results from Turkish clinics and warned me what a bad transplant could look like. He explained about the shedding phase, the hair life cycle, recommended finasteride, minoxidil. Basically, he said all the right things and seemed very genuine. Based on this original consultation, I booked in for the operation with no worries at all, thinking I had a great doctor.
So at this point, has he gotten this hairline designed at the consultation phase, or does it not mention?
I don't think it mentions, because it straight away talks about him booking.
Let's send the story and develop.
Okay, so I paid a fixed price for the day, unlimited grafts for £2,500. He told me that
£2,500, okay.
And he told me that 500 grafts would be enough to cover the area.
Okay.
But ended up putting in 678. I didn't know at that time how inadequate this would be. I'm going to show you the photo in a bit.
Okay. It really sounds very inadequate for any kind of hairline surgery.
So on the surgery day, the operation was a lot longer than I expected, and I had a funny turn in the morning after laying face down for approximately 3 hours for the extractions. The doctor suspected a reaction to the anesthetic.
A funny turn. Well, what's that in understandable terms?
He doesn't explain much.
Okay, maybe some drug side effect, something, unforeseeable, maybe a bit of nausea, or sometimes after sedation, you don't really remember the events after that. Might not be anything all that worrisome, actually.
So he said that he took over an hour for lunch to recover, and the implantation stage took approximately 7 hours, from around 1:30 to 8:30. The anesthetic kept wearing off towards the end, so it was quite painful at times. The extractions were done by Dr. As were the incisions. Implantation was by the doctor and the technician. After surgery, my wife picked me up and drove me home, where I fell straight asleep.
Okay, so it is kind of standard procedure from what it sounds like for a doctor to be doing the harvesting as well as the side making incisions. And the doctor might choose to implant the hair follicle grafts himself or together with a technician, or this actually can be delegated to a technician if the technician has been properly trained to place grafts using a forceps or using implanters that are blunt. So it still sounds pretty legit.
Okay. So far, no red flags.
I mean, the number of grafts sort of is a red flag already in itself, but let's maybe it was a very, very small hairline correction, or his head is very small and the surface area is really puny and just requiring just 700 grafts.
Okay. I think I'm going to show you the photo that he attached onto the post that we see from there.
Wow, okay, so that's 10 days post-op. Immediately, what I would think is that's not enough grafts to correct a hairline that's that receded. This is Norwood, looks like Norwood 3 if he's not done any recipient area shaving. It's left quite a big gap in between the implanted hairs and the native hairline. Usually when we do surgery like this, we want to go into the native hairline to cover the transition zone. I'm assuming that the midpoint of his current hairline, native hairline, frames his face adequately, aesthetically. But looking at the temple recession that's also going on, I will also offer to correct the temples at the same time. This would easily have been like multiple number of grafts, multiple times the number of grafts that he previously was quoted. Do you have any other photos?
Yeah, I think we do. Okay. So this was day of the post of the operation, and then the morning after the operation.
So we don't usually allow scabbing to occur so obviously. We tell our patients to keep the areas quite clean using sprays and serums. Of course, not to batter the grafts with a lot of vicious pressure, but just be light and gentle with it. I think she's done that because the morning after the surgery, well, at least on the left side, it looks like there's been some kind of cleaning going on with maybe a saline spray. And then it jumps to 10 days post-op, and it looks a little bit red and indurated, possibly a feature of infection going on there. I would say that implantation density is probably about 25 per square centimeter, maybe even less than 25 per square centimeter, which is not going to be adequate to do hairline work. We want it roughly 45-50 per square centimeter when we are doing the hairline work. It's good that you put single grafts in the front few rows of the hairline. I would stagger it, not make it look so squarish and grid-like. Give a little bit of, purposeful asymmetry and a micro hairline design, areas of high and low density, just to make it all look a little bit more natural. I suspect the outcomes for this are not going to be great. And even more worried about the possibility of infection at this stage. How does the story develop?
Okay, so let's go back to the story. So going back to the story, the next morning when I woke up, I felt physically fine. But when I looked in the mirror, there was heavy scabbing over the grafts, which is what we saw earlier.
Yep.
And a big gap to my existing hairline that had literally nothing on it.
Right, so that's the transition zone, right? Which you mentioned.
The hairline was not neat nor defined. I wouldn't even call it a hairline, nor did the rest of the work look dense. I emailed the surgery with my concerns, and they told me some grafts would have been feathered in and many grafts aren't always visible, as blood does not represent where all the surgery has taken place. I took him at his word. I didn't know any different. On day 10, after taking the scabs off, I could see a clearer picture. There were gaps, lots of gaps. I made a post on Reddit, and it was brutal. I was hoping for reassurance, but got quite the opposite. Every single comment was shocked with the work. One comment asked if I had done it in an alleyway. Another one asked if I had done it myself at home. So my favorite one, the worst one, was, "My brother in Christ, please name and shame the spawn of Satan who did this to you." After the first 10 or so comments, I couldn't bring myself to read or reply to any anymore.
That's when you know I made a big mistake.
I just deleted the account. I was really down and I just didn't want to hear it. This is the first time I've logged in since. I emailed the doctor the next day with my concerns, and he told me, "Please don't worry in this early period. If there is a gap, it will be covered as it grows as the hair is styled. And as with all our patients, we want you to have the best results. So if you need any adjustments in the future to fill in areas that are deficient, we will do this for you without charge."
It's like who though? Like Is it going to be the same surgeon that does the free touch-up? You're going to have to wait a full year for the hair to grow up before you even enter the donor area again. Ideally, wait for a full year. All these point to the surgeon giving you reassurances that he's going to make good of a defective job if there was a defective job done. But if you're getting large-scale responses across an informed community that this was a shoddy job, I would be very careful and immediately seek a second opinion.
I think so too. So I saw the doctor again at 5 months. I had a little bit of growth coming through, but not much. He again said that it would grow through and that 5 months was still very early.
It is a bit early. So usually 6 months is when you start seeing adequate growth for it to be termed a hairline, right, with some degree of coverage. So it's a little bit early, but you should be seeing some good results at about the 6 month mark, so not too far away.
Okay. So he said that as I still had redness in the scalp, it indicated that more hair was still gonna go through.
That's a bit of a worry. There are situations where scalp redness, as this photographed gentleman was Caucasian, so sometimes redness does persist for a little while after scalp surgery, maybe a week, 2 weeks. At the very most, you're gonna give it 2 months. Anything more than 2 months, you're gonna start screaming for help. Go to a dermatologist, plastic surgeon, anyone who does hair transplantations regularly to seek help. There are a bunch of things that might need to be done to bring the redness down because it's right at the front of your forehead, man. You can't hide it unless you can wear a cap to work. The photos aren't as close up and it's kind of covered up by scabbing, so we can't see whether there's any kind of graft placement nearer the transition zone. It certainly looks very bare to me. In fact, in most surgeries, we'll go inside of the transition zone, like within where the hairs are, the native hairs already are. Because the likelihood of what's going to happen is in another 5 years that already receded hairline is going to recede slightly further, and you just want to bolster it with extra grafts to support that transition zone so that you don't have to do a touch-up surgery quite so soon. Even with medications, you're just going to slow down the hairline recession if he's already gotten that bad of a hairline recession at this age. Now, the other thing that pops up as a red flag, which we want to kind of highlight here, is 2,500 Great British pounds is kind of a low price for a hair transplant procedure, and unlimited grafts is definitely a red flag. You do not even have unlimited grafts in your scalp, so there's no way a surgeon can promise you unlimited grafts. The maximum lifetime available grafts is estimated to be approximately 5,000, 6,000 if you have a larger head. So that term, unlimited grafts, if you see that, run far away.
Okay, but what about his case? So you've seen the photos. How many grafts do you think, like roughly, you would take?
Probably a couple thousand.
Okay, a couple thousand from 600 grafts. Okay, so again, I took him at his word, buried my head in the sand again, and convinced myself it would thicken up. And if not, a free top would sort me out, right? I am now at 7 months, and the pictures speak for themselves. Yeah, okay.
Okay, it's quite clear to me why this is happening at 7 months. But let's comment on the photos first. The directions are off, right? It's not following the natural direction of the hair. This looks like his left side, and the hair seems to be pointing in a down and centrally pointing direction. You want to kind of follow the natural directions of your original hairline. Now, oh my gosh, and that's his right side, and the right side looks extremely laggy. They're planted with too much distance in between them. The density is too low. Having a little bit of we'll call it king tears at this point is not the worst thing. They usually get a lot smoother as time goes by, but their density is barely adequate.
Yeah, so I think he stopped the photos at 7 months post-op.
Well, that's a pity because we want to see what the full growth is, which is usually 12 months and beyond. And it's also a pity that he's had this terrible experience with a hair transplant surgery. Makes for a very good Halloween story, but he certainly needs a touch-up surgery, and a touch-up surgery is still unable to correct implanted grafts that are of a wrong direction. So what would have been done if the direction is so grossly off, is you might actually have to punch out those implanted grafts and change the direction of implantation again.
So basically redoing.
Yeah, so in I would say a small number of grafts like this, maybe we can try to overpower the wrong direction with planting a larger number in the correct direction, and these might feature very minutely on the end product. As we talk about a reconstruction of a botched surgery or repair of a botched surgery, but with some of them that are where the angles are too obtuse or too vertical, you really have to just punch them out and redo the surgery.
Speaking of reconstructing botched surgeries, is it okay to ask how much experience do you have in doing that here at Terra Medical?
We see a lot of them. Yeah, we get a lot of one inquiry a month on hair transplant repair surgeries. Sometimes they are done in a black market setting in an alleyway, or done in a clinic with a transplant technician doing all the work from harvesting to implantation, and there's no kind of concept of aesthetic finesse, even though they've been doing it for decades, and they can tell you they've been doing it for decades. But when it comes to seeking recourse, you can't seek recourse from a technician, right? Maybe you can seek recourse from that clinic that's registered with the Ministry of Health, but at the end of the day, you want to be sure that it's the surgeon that's supervising the whole surgery, who is experienced in hair transplants, and very specifically your preferred type of hair transplant, be it facial hair, eyebrow hair, scalp hair, body hair, that is actually doing the surgery or doing most part of the surgery except the delegatable portions. Yeah. And should that surgery still appear to be not your desired outcome, you can easily seek legal recourse against that surgeon.
Okay, so I have one more question.
Okay.
The guy in the Reddit post mentions so many supposedly green flags, like the doctor mentions how to avoid a pluggy look, like the doctor also, he also mentions other green flags to look out for. He even shows what to avoid, like images of bad surgeries and stuff. And he even has photos of him at a conference with other doctors.
Mm-hmm.
So at this point, how else is a patient supposed to know if the doctor he's going to is legitimate?
Okay, that's a very commonly asked question. So there are certainly consumer advocacy groups that are out there. Some of them, doctors pay for to be listed on their websites, but if you want something that's non-biased, there are two main organizations that are internationally quite well known. The International Society of Hair Restoration Surgery. If your doctor is a member there, he has to practice ethically, and he undertakes that he does the surgery instead of delegating it to technicians or unlicensed medical professionals. And the ABHRS, or the American Board of Hair Restoration Surgery, which is the only certifying kind of institution worldwide. If you see your surgeon has a diploma of the American Board of Hair Restoration Surgery, you should feel rather comfortable that this guy has done quite a lot of hair restoration procedures. But then when we go into the minutiae, such as beard, facial hair transplants, sideburn transplants, eyebrow transplants, those are out of the purview of those two accrediting bodies. You still want to see that the surgeon has done quite a number of those surgeries to give you a good outcome. So ask to look at his before and after photos. Ask about any complications that he is personally or she has personally experienced and how they remedy it. And if those complications should arise in you, how is the surgeon going to help you remedy it? The veracity of any kind of aesthetic surgeon, it's really quite hard to ascertain based on a one-to-one consultation. Ask around your friends, hair transplant is a pretty common procedure nowadays. If a friend or more that has gone for a procedure, ask them how their doctor did the procedure. Was it done in a clean, professional setting? Did it get good results? If the results were a bit lackluster, what was the recourse that was taken? And ask on forums, there's hair transplant forums that are international or local, and go on there and ask them for recommendations. There are plenty of people who post positive outcomes and negative outcomes out there. Just do your homework and actually meet your doctor in person. Even in the day of teleconferencing, I still prefer to have hands on hair, on scalp, assessing the laxity, the quality of the scalp, using a microscope to see if the scalp is of good quality, and what can we do to get the best outcome for this patient. So book a face-to-face appointment with your surgeon, get in there and let that assessment take place. If you feel comfortable, then maybe that's when you talk about going ahead with a hair transplant procedure, which is going to be a long-lasting outcome for your aesthetic appearance.
Okay, so I think that's all for today's episode.
Scary enough.
I'm wishing this guy a lot of good luck.
Yeah. Good vibes to him. I hope he got it all corrected.
So that's all for today. If you do like the content that we have shared, then leave a like and a follow. And then let us know if you still want to hear more horror stories, even past Halloween.
I mean, there's many, many horror stories out there. So you can go online and look at the ISHRS campaign called Fight the Fight. And there are going to be examples of horror stories coming out from all corners of the globe. And then you might be wiser in your choice.